My endometriosis excision surgery date has been confirmed, so now I'm going to be focusing on what supplements to take before and after surgery. After a lot of research, I've come up with a supplement stack. Supplements to effectively take daily in the weeks before and after surgery to help prepare the body for surgery and to aid healing after surgery. And a lot of these vitamins I already take for my endometriosis to help with my pain and other symptoms, but there's a few additional ones on top that you will find helpful. Let's start with some of my existing supplements that I take daily that I've already shared with you. Euphornerve's Glutathione. Aim to take 250 to 500 milligrams of glutathione on a daily basis, typically first thing in the morning or on an empty stomach, whenever that may be for you. With Euphornerve, one serving gives you 400 milligrams, so you're right there in the middle. As I've already shared, glutathione aids liver detoxification, and with regards to surgery, here's what it can help with. Clearing anesthesia and medications, reducing inflammation and aiding tissue repair, preventing post-op infections by boosting the immune system. Moving on to PEA. If you saw my video on PEA, then you will know that this helps reduce inflammation and relieve pain symptoms. And it supports nerve healing. When it comes to surgery, nerves can be damaged, so we need all the help we can get, because nerve damage can result in symptoms such as more pain, more intensified pain, new pain, numbness, tingling, you name it. So by taking PEA both before and after surgery, you're effectively helping yourself reduce surgical associated pain and speeding up the healing process. Directions for PEA: taking 2 capsules either after a workout or before bed. It works in a similar fashion to CBD, so I typically like to take it after I work out, as I'm at the gym 4 to 5 times a week, so that's when I'll pop 2 of these babies. If you didn't know, if you're going to shop some Euphornerve supplements, including the 2 that I've showcased here, tap the link in my bio, shop Euphornerve, and apply code LENA15 at checkout to get 15% off any purchase, as long as it's not a subscription one. And enjoy. The next supplement I'm going to mention is vitamin C. Yes, it might seem pretty basic, but it's actually a powerful antioxidant, so it works pretty well teamed with glutathione. Now we know vitamin C aids the immune system and it helps with collagen, which is helpful when it comes to after surgery because of wound healing. In the 2 weeks before and the 2 weeks after, aim to up your dosage to approximately 1500 milligrams to get the most out of it. The next supplement I'm going to talk about is bromelain. Bromelain is an enzyme. It's found in pineapples. It works to help reduce inflammation and swelling. It improves healing and it supports pain relief. Once again, in the 2 weeks before and 2 weeks after surgery, pop 2 capsules a day, preferably on an empty stomach. Next up, we have arnica. You may have come across arnica in the cream version, which is meant to be applied topically onto the skin where there's bruising. Some women use it after doing certain cosmetic procedures. Also comes in pellet form. Like bromelain, arnica helps reduce bruising and swelling. It minimizes post-op pain and it speeds up healing. You basically pop 2 of these straight in your mouth, no hands, 2 to 3 times a day. I'm going to start the day before my surgery and then continue 2 weeks after my surgery. Next up, B vitamins. I like to take vitamin B6 and B12 and methylated folate on a daily basis anyway. And as they're safe to continue taking for surgery, I'll be taking it pre and post-op as well too. Women in general should be taking B complex vitamins anyway for their health, which you can also get with Euphornerve. They also sell a B complex with folate supplement if you're interested. Then you have vitamin D3 and vitamin K2, which are best taken together. Again, I take these on the daily anyway. Vitamin D3, as we know, helps support the immune system. And with regard to surgery, vitamin K2 can help with blood clotting, which may be beneficial for surgery too. If you wanted a Euphornerve one, get both vitamin D3 and K2 in the form of soft gels from Euphornerve, but obviously feel free to shop anywhere. Next up, we have zinc. Another important supplement for women's health and endometriosis too. I'm going to continue taking it before and after surgery. You can take anywhere between 15 and 30 milligrams to support tissue repair and boost immunity. And you guessed right, Euphornerve have a highly absorbable form of zinc called zinc picolinate. Once again, if you do choose to shop from Euphornerve, make sure you enjoy 15% off on me with code LENA15. I'm also going to be taking probiotics because I've just finished my antibiotics for the UTI. So we need to repopulate the gut with good bacteria. And then as per usual, I'm going to be taking a broad spectrum of magnesiums. I take these anyway to aid with my endometriosis pain, to aid my sleeping. With regard to surgery, it's going to help reduce muscle tension and cramps and support relaxation. As we all know, when you sleep is when you recover and repair and regenerate. So it's of the utmost importance to get a healthy amount of sleep. So that rounds up my supplement intake. I'm sticking to the ones that are going to support my immune system, help reduce inflammation, help reduce pain, help aid relaxation, help aid sleep, help aid recovery, reduce swelling, reduce bruising, and aid tissue repair. All of these things are of the utmost importance so that I can recover and get back to my best self in the quickest, most efficient, in the safest way possible. So let me know if that's your goal too. Let me know if you found any of this helpful. If you have any tips of your own of what's helped you with your surgery recovery, do share in the comments.